Well, it's happened again, this time to a very famous woman. A woman has died undergoing a cosmetic plastic surgery procedure. Former Miss Argentina Solange Magnano, the 38-year-old mother of two, is having what's called a gluteoplasty. That means, frankly, when you have your rear end lifted a little higher. However, the surgery went horribly wrong, and according to reports, she threw a clot to her lung or to her brain. She suffered acute respiratory deficiency, and she died. Joining me now is Dr. Scot Glasberg. He's Vice President of the American Society of Plastic Surgeons, and he's also a practicing surgeon here in New York City. Thanks for taking the time, first of all, Scott, to come in. But it's always these big, egregious cases that, frankly, put a spotlight on your subspecialty where people go, how could this kind of thing happen? First of all, let me just start with the basics. Why would a woman want to have her fanny changed at the ripe old age of 38?
Well, let me start by saying that the death of any patient is sad and tragic, and my heart goes out to the family after this. Women want to enhance parts of their body. It's a body image thing and whatnot, especially those in the media. You know, there's certain personas that are put out there. But it is not an uncommon procedure to have a buttock lift or to have a buttock augmentation, and they can be done safely, and that's the key.
I think one of the things people don't understand about any of these larger procedures, and I would put this in the liposuction, is that a lot of times fluid is pumped into your body, and if you don't have a responsible doctor and you put fluid into a body or you remove fluid from a body, you can shift fluid so much that you change how your heart works, you change how your lungs work. There was a case in Florida just a few months ago where a woman went to do a strip mall kind of meta spa. She died.
And that's the absolute key. You need to know who your surgeon is. I'm lucky, and I'm in a profession that I love. I love being a plastic surgeon, but a lot of people want to be plastic surgeons. And patients need to understand who it is they're seeing if they're really a plastic surgeon. They need to do their homework. They need to know that their surgeon is a board-certified plastic surgeon, that the facility that they're being operated on is an accredited facility. I can tell you the American Society of Plastic Surgeons, all of its members are board-certified and are required to operate in accredited facilities. So patients need to ask the right questions and get the right information and not be shy about asking those questions, because that's the key. You know, we're talking about a patient's health.
And in this country, we're not going to draw a parallel to Argentina, but in this country, if someone's offering plastic surgery at the same place where they're doing nail tips, a red flag, not a place to go have a procedure done.
Absolutely. I mentioned an accredited facility. That doesn't sound like a place that would be an accredited facility.
And very fast question to you. Have you turned patients away?
Absolutely. I do it all the time.
Because you think they're not mentally stable,
you know,
they want too much?
When I see patients, I'm building a bond. I'm building a relationship with those patients. I want to be comfortable with the patients. I want the patients to be comfortable with me. I will tell you, I will never operate on a patient without meeting them twice. And I encourage them to bring family members along, because there will be questions that will come up from them as well. And it really is a bond and a relationship, and everybody has to feel comfortable in that relationship.
And man, oh man, if ever there's a time, do your homework.
Absolutely.
Dr. Scot Glasberg, thanks, Scott.
Thank you very much.
Well, up